Hi everyone, and welcome to another episode of Inspiring Careers. My name is Dan Johnson, and I'm here today to again present you with another award-winning industry specialist who will give you some fantastic advice. Her name's Cara Gibson. She works as a medical science liaison within the pharmaceutical industry. And as far as awards go, she's done very, very well in her career. She has been the MSL of the Year finalist for 2015. She has won her company, Novartis, the Field Medical Excellent Award for 2016. And she's won the Novartis UK Award for Values and Behaviours in both 2015 and 2016. Good afternoon. Hi, Cara. How are you doing?
Hi, Dan. Yeah, I'm very well, thanks. How are you?
I'm very well. It's very hot recording, but otherwise can't really complain at sunny weather because it's lovely. What would you say then are your top 3 success secrets that have helped you out most in your career?
Number one, know your data. I know that sounds really obvious and really basic, but we are communicating with some incredibly intelligent individuals. A lot of them might be professors, doing a lot of research themselves, and they're going to want to know that you know what you're talking about. I think second of all, we're taking up important time in clinicians' kind of days, and so whatever amount of time you get with them, utilize it in the best way possible. So I would say, do a pre-call plan, know what you're going to talk about. If you've agreed that before, stick to it.
Okay.
Have a discussion on the day, present your data well, in an easy to understand format.
Yep.
Be ready for follow-up questions. And then afterwards, if you've got actions or the doctor has actions, follow up and kind of make sure they're completed, whenever you've agreed to have them done by. The third one, I think, know who you're speaking to. Do a lot of background checking. A lot of these clinicians and academics that you'll be speaking to have published, they've done work. Maybe it's even just audits locally that they've presented. Dig deep and see what you can get, because I think it makes for a far more engaging conversation if you've done your homework.
What would you say is your biggest career failure, and how did you overcome it, or how did you come fighting back in response to that failure?
Yeah, so probably my biggest failure, if you like. I was putting together some kind of information and some slides, and I suppose, coming from science background, I like to go into the data, I like to go into a lot of detail, and I think I just jumped into it in far too much detail, and figuring, everyone would get it, it would be fine, it'd be easy to communicate, etc. And actually, it wasn't met with that great a reception, if you like. So people were like, oh yeah, it was useful. And then I spoke to some doctors I knew really well, like, actually, we think you need to top line it a bit more and then go into the depth. And I was like, oh, okay. So I went back to the drawing board, kind of redid all the slides, changed a few of the diagrams. All the data was the same. The takeaway message was the same. So yeah, for me, I was kind of like, that was a huge learn. And I'm so thankful that I spoke to those doctors, because if I hadn't, and I hadn't had that feedback, then I still would have been doing the exact same thing, and people really wouldn't have been taking it on board as well. But yeah, I think it is, changing that mindset and thinking, what does the person that you're talking to need out of this? At the end of the day, what decision do they have to make, and what are they trying to achieve? And I think once I got that more in my head, and I spoke to the doctors about the presentation and got that feedback, and it's so good to get feedback as much as possible.
Yeah.
I connected that all together and thought, yeah, I do need to tailor this slightly differently. And once I did it, the feedback was far better.
Okay, so what's the one thing that you see that is holding people back from being successful in their careers? What do you think is holding other MSLs back?
It's just being, proactive. It's, asking for that feedback, from your doctors. What could you do a bit better? What worked well, what didn't work well, and whatever feedback you get, just instantaneously incorporate it. And then that's quite externally focused. And from an internally focused perspective, what more can you do in the company? I probably did a lot of extra bits that maybe some of the other MSLs weren't doing at the time. So, getting involved in our clinical trials, I helped to write one of the trial protocols with the medical advisor at the time. And it's things that I was quite passionate about. But in fact, it helped me in kind of my day-to-day job as well. Because when we started kind of running that trial, I knew it probably better than anyone else did, which made me the expert, and it just allowed me to communicate far better with my doctors and the researchers in hospitals.
How do you like to approach the MSL role, and what do you think really helps you stand out as an MSL?
I think you just have to be so careful to always maintain your integrity as an MSL, and that you're there to provide the information. The doctor should want to hear this information. They should have agreed to the meeting, etc. And just making sure that you never stray from that. You never take advantage of, because I think the day that any MSL does that is the day that they lose respect in their customers' eyes. And yeah, I think it's very tough to ever move on from that point.
What do you think makes it really a lot easier to act with the integrity that you feel is right?
I just think it's every time you have a meeting, every interaction that you have, you just say, what's going to benefit patients the best. And at the end of the day, that's hopefully why we're all in this role and in the industry, is to see some positivity for, the end user, if you like. And so almost put yourself in the patient's perspective or the doctor's perspective, or both, actually, I try and do. And if you do that every time, I think you should come out with the right way of doing things.
What is your final piece of career advice for any MSL who's currently watching this video?
So for me, don't be afraid to fail. I think have some new ideas, bring them up, talk about them, try and introduce them, and if you can get them introduced, just get behind them full force. And yeah, do you want to know what? If it doesn't work, learn from it and just don't do it again.
Okay, Cara, listen, it's been an absolutely fantastic interview, and it's been a great pleasure having you on my show. Cara, if anyone has any questions or would like to talk to you further about some points that have been discussed today, can they connect with you on LinkedIn and just get in touch and ask further? Would that be okay?
Oh, yeah, of course. I'd love to chat to anyone that wants to ask any questions. Feel free.
Fantastic. And like always, if you've enjoyed the show and you have any questions, you're free to get in touch with Cara on LinkedIn, and you're free to get in touch with me as well. Please do like, share and comment. My name's been Dan Johnston. This has been Cara Gibson. Cara, thank you very much for being on the show, and I look forward to seeing everyone again soon. Thanks very much.